What is cholangitis? Welcome to our video on what is cholangitis. Cholangitis is a serious condition that affects the bile ducts in the liver. Understanding its causes, symptoms, and treatment options is crucial for early diagnosis and effective management. In this video, we'll delve into the details of cholangitis, exploring everything you need to know about this potentially life-threatening condition. Let's get started. 1. Understanding cholangitis. Cholangitis is an inflammation of the bile ducts, which carry bile from the liver to the gallbladder and small intestine. Bile is essential for digestion, especially the breakdown and absorption of fats. When these ducts become inflamed or blocked, it can lead to serious complications. 2. Types of cholangitis. There are two primary types of cholangitis. Acute cholangitis, also known as ascending cholangitis. This type is often caused by a bacterial infection that spreads from the intestine to the bile ducts. It is a medical emergency that requires prompt treatment. Primary sclerosing cholangitis, PSC, a chronic, progressive condition where the bile ducts become inflamed, scarred, and eventually narrowed. The exact cause of PSC is unknown, but it is often associated with inflammatory bowel diseases like ulcerative colitis. 3. Causes and risk factors. The causes and risk factors for cholangitis vary depending on the type. Acute cholangitis, bile duct obstruction, often caused by gallstones, strictures, or tumors, bacterial infection, typically involves bacteria from the intestine entering the bile ducts. Medical procedures. Procedures like endoscopic retrograde cholangiopancreatography, ERCP, can sometimes lead to cholangitis. Primary sclerosing cholangitis, PSC. Autoimmune factors. PSC is thought to be related to autoimmune processes, inflammatory bowel disease. A significant number of PSC patients have underlying inflammatory bowel conditions. 4. Symptoms of cholangitis. The symptoms of cholangitis can vary in intensity and may include acute cholangitis, fever and chills, often accompanied by sweating and shaking, abdominal pain, particularly in the upper right quadrant of the abdomen, jaundice, yellowing of the skin and eyes due to elevated bilirubin levels, nausea and vomiting, common gastrointestinal symptoms, dark urine and pale stools, indicating issues with bile flow. Primary sclerosing cholangitis, PSC. Fatigue, chronic tiredness and weakness, itching, often severe and widespread, jaundice, yellowing of the skin and eyes, abdominal pain, especially in the upper right quadrant. 5. Diagnosis of cholangitis. Diagnosing cholangitis involves a combination of clinical evaluation, laboratory tests, and imaging studies. Medical history and physical exam. A thorough examination and discussion of symptoms and medical history, blood tests, elevated white blood cell count, liver enzymes, ALT, AST, and bilirubin levels. Imaging studies, ultrasound, CT scan, or MRI to visualize the bile ducts and detect obstructions. Endoscopic procedures, ERCP or percutaneous transhepatic cholangiography, PTC, to directly examine and treat the bile ducts. 6. Treatment options. Treatment for cholangitis depends on the type and severity of the condition. Acute cholangitis, antibiotics, to treat the bacterial infection, biliary drainage, procedures like ERCP, to remove obstructions and allow bile to flow, supportive care, intravenous fluids, pain management, and monitoring in a hospital setting. Primary sclerosing cholangitis, PSC medications, ursodeoxycholic acid, UDCA, to improve bile flow and reduce liver damage. Endoscopic treatments, to manage bile duct strictures, liver transplant, for advanced cases with liver failure. 7. Complications of cholangitis. Cholangitis can lead to serious complications if not promptly treated. Sepsis, a life-threatening infection that spreads throughout the body, liver abscesses, pockets of pus within the liver, chronic liver disease, including cirrhosis and liver failure, cholangiocarcinoma, a type of cancer that develops in the bile ducts, particularly associated with PSC. 8. Prevention and management. Preventive measures and management strategies include managing risk factors, treating gallstones, avoiding excessive alcohol consumption, and managing inflammatory bowel disease. Regular monitoring. For patients with PSC, regular follow-ups with a healthcare provider. Vaccinations. Hepatitis vaccinations to protect liver health. 9. Living with cholangitis. Living with a chronic condition like PSC requires lifestyle adjustments and regular medical care. Diet and nutrition. Eating a balanced diet to support liver health, physical activity, regular exercise to maintain overall health, emotional support, counseling or support groups to cope with the emotional impact of a chronic illness. Conclusion. Cholangitis is a serious condition that requires prompt medical attention and ongoing management. Understanding the causes, symptoms, and treatment options can help you take control of your health and seek appropriate care when needed. Thank you for watching. If you found this video helpful, please like, comment, and subscribe for more health information and tips. If you experience symptoms of cholangitis, consult a healthcare provider immediately. Stay informed and take care.